Happy Monday. I have been up for quite some time. I have a lot of people going in for procedures today. A lot of surgeries, biopsies, dental surgeries, all kinds of stuff. What I offer my clients and patients is it's similar to a guided imagery, and it will provide a little relaxation, lessening your anxiety, your apprehension, your fear, your terror. Because as you go into a surgery, the better you feel going in, the better you're going to do. So it takes, 5 to 10 minutes just to get you calmed down and relaxed, knowing everything's going to be okay when you're going in, everything's going to be okay during the procedure, and everything's going to be okay in your recovery. And I do offer postoperative care, of course. And my people do great. They have substantially less pain, discomfort, swelling. They soar. I'm so proud of my people. They just do so well. And a little side note, the people that I treat that are on chemo and radiation, maybe 1 or 2%, seriously, 1 or 2% have nausea and vomiting and diarrhea and bone pain. Everybody does great. They, for the most part, can eat. They sleep well. You do experience fatigue. I cannot do anything about the hair loss. Trust me. When I went through chemo, I wish I could have kept my hair. I didn't. I was as bald as I could be. But it's okay. Hair grows back. A little different than you may have had it initially, but it does grow back. So I do offer a wide range of services, including, what I do for my chemo radiation patients, and I can do it when they're at home. I can, if they're local, if they're in the greater Phoenix area, I work with your oncologist and radiation oncologist because it's all about being a team player. And depending on COVID at their facility and everything, I can, gown up, mask up with the best of them and be there during chemo sessions. And yeah, you'll do just fine. You'll probably sleep through the chemo because Reiki makes you very sleepy, which is good. I can do it at the facility. We can do it online. I have a lot, because of COVID primarily, I have a lot of clients that I treat online, and that's fine. We just video chat, kind of like we're doing right now, and they get Reiki, and they're happy campers. They just do great. So if you're interested, please let me know. If you are a doc and you want me to work with some of your patients, give me a call. We can talk. I would love to do that. I find so much joy in helping somebody who's struggling with, whether it's cancer and the side effects of chemo and radiation, pain management issues, because that can, pain, chronic illness is so debilitating, not only physically, but emotionally. And this will do a lot. The guided imagery, relaxation, hypnotherapy, and Reiki can do wonders for your people. Absolutely. So if anybody's interested, let me know. I will be more than happy to talk to you. And if you're in, like I said, the greater Phoenix area, let me know and we can sit down and talk. We can always do a Zoom. And I do treat people all over the world. I have a huge clientele in India, believe it or not. I work with JPRC, which is the Jaipur Pain Relief Clinic, and Dr. Sanjay Sharma. And we work together, and he's pretty amazing pain management doc. He's doing some very cutting edge things. And, I have patients in, like I said, India, Egypt, the UK, a lot of people in the UK. It doesn't matter. Energy knows no bounds. It's like love. Distance doesn't bother love. Distance doesn't bother energy. The sun is how far away? It's energy. We feel it here on Earth. It's energy. This works. It's been around for centuries. So, if you want to give it a try, let me know. If you're concerned about cost, I have sliding scales. Don't worry. I don't ever want anybody to worry about the cost. I want to be paid. Absolutely. I have too many people right now that aren't paying. But, if you're willing to make payments, I'm willing to work with you. Okay? So let's make it happen. I will keep everybody posted on how all my people in surgery are doing. I have no doubt they're going to do very, very well. They have brilliant surgeons and medical teams, and their families that are loving and supporting them, I know, and are fantastic and phenomenal. So it'll have a happy ending. We keep happy thoughts. You are what you think. If you go into a situation with a positive attitude, you'll come out of it much better off than going into it with a negative attitude. People are, notorious for saying, oh, well, I knew somebody that had what you have and this happened to them, or boy, I had whatever you had and it wasn't good. Ignore them, okay? A lot of people do that so they feel a little superior, so they feel a little bit more in control because they know and you don't. Yeah, well, they're wrong. So it's okay. Go into it with a positive attitude and you will have a much better outcome. Your doctors will tell you that. So I will wrap it up. Have a good Monday. If you need me, I'm here. If you just need to vent and talk, honey, there's no charge for venting and talking. You shoot me a DM, okay? I've got your back 24/7. I'm here.